Now, Dinesh Thakur, when he started discovering the fudging of data, and he discussed it with Arun Kumar. And Arun Kumar's response was, what is wrong with you guys who go to the United States for a few years and think you've become the moral police of the world? Do you think US pharma companies never do such things? Now, in his 10 years with a big pharma, Thakur had never seen or imagined such conduct. But he said, let's get on with it. Where do we start? And then Arun goes to a whiteboard and draws a diagram of, by region, the liability that Ranbaxy faced. The United States and Canada at the bottom, Europe next, Latin America above. Above that, India next, and the rest of the world, which means the poorest of the poor nations, Africa. So Arun says, pointing to the top, I'd start there. Thakur then asked him that what is the percentage of the dossiers submitted to regulators contained data that did not match what the company had on file. So the assistant says it varies from region to region. So Thakur then asked him, give me an estimate of each region. How about the United States? So he says 50 to 60%. How about Europe? About the same. And when he asks about India, after some hemming and hawing, the assistant answered 100%. So we in India were taking drugs that in no way met efficacy trials or side effect trials or even the expiration dates, adulteration, none of that was checked.
So, just to be clear, when any drug company wants to market a drug really anywhere in the world, what they have to do is submit an application to regulators. And that application contains data from testing, detailed data that shows the drug is bioequivalent, there's no toxins or impurities, and the passage that you're referring to, basically you're saying, for India, we just made up all the data because no one ever checks. And what that amounts to, I sort of think of it, it's a giant malign science experiment with all of us and all of you as Indian consumers and patients as the guinea pigs. So, the system that the book exposes is basically a manufacturing standard that amounts to whatever you can get away with. So in countries where the regulation is the weakest and no one's checking the data, we just fake all the data. And in countries where there's more regulation, we fake some of the data, right? So, but that was to me really the shocking thing. I mean, I started this investigation basically thinking, well, a pill is a pill, right? If you're in the US and you get Lipitor in a pharmacy, it's no different than if you're in India and you get Lipitor in a pharmacy. And even, of course, many Americans think they're geniuses because if they come over here for tourism, while they're here, they can go and get medications that are cheaper. But not so smart, as it turns out, because really, that drug may be quite different from market to market, depending on the vigilance of the regulator and depending on the ethics of the company that made it. And I think it is very, troubling that many of these generic companies are just dumping their worst drugs into markets with poor regulation. And sadly, India is considered one of those markets.